Aguilar, seconded by Jameson. Any questions, comments? All those in favor, say aye.
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 Minutes are approved. We have one agenda item today, and we do need to be done by 6:15, so we will get right to it. And it's Engaging Citizens in Fiscal Policy Decision-Making by Joyce Malinsky. She's the director of the South Dakota Budget and Policy Project. This is a presentation that she gave to the Breakfast Club when the city, county, schools all meet monthly at the Washington Pavilion. And we thought it was a very engaging presentation and wanted to share it with the full council and for the benefit of the public on Channel 16. Joy comes to this with lots of background and expertise. She served on the school board. We almost have a quorum of ex-school board members today, right, Sue? So with that, Joy, we'd ask you to come to the podium and we will get started. Welcome.
Thank you. Am I?
You are on.
I'm on, okay. Well, I appreciate you inviting me to come and join you today and talk about engaging citizens in fiscal policy decision-making. Because that's really the nature of the work that I'm doing through the South Dakota Budget and Policy Project, and that I shared with the Breakfast Club and that you were interested in at that time. I work for the South Dakota Budget and Policy Project, and our mission is to promote responsible and equitable to promote responsible and equitable fiscal policies through research and education. Now, as locally elected officials, you are responsible for the budget. Citizens are also responsible not only for electing you, but for giving you feedback on what fiscal policies are important to them, what they think about the tax policies. But in order to do that, in order for them to be able to communicate with you, they have to understand the budget process. They have to understand what policies are currently in place. They have to be able to understand the consequences of the policy choices that you face. And then they can give you informed feedback as your constituents. The work that I've been doing has been analyzing the state budget and the state budget process to try to create tools so citizens can understand the state budget process and provide feedback at the state level to their legislators. I want to share some of the type of materials that we've put together along that line with you today, and then perhaps we can also talk about ways that that type of approach to citizen engagement to involve citizens in their local decision-making process could work at the local level as well as the state level. State government is really the process of coming together around a shared need for common services. We decide what it is that we, as people who live in the state, want to have as common goods and services, and then how we're willing to pay for them. That means that one of the most important policy documents that we work on each year is our budget. That's what really impacts the quality of life that we have, the investments that we make for the future, and it tends to be the document that's probably least understood by the citizens. Therefore, teaching citizens how to approach the budget process, how to be a voice in that budget process, is the first step of public engagement. Ideally, that budget process should be a reflection of our shared values, the things that we're willing to pay for together. And it should be a reflection also of what we understand as our priorities. When you think about the budget process, it's easy for us to come to that and say, well, I want more money for school teachers. I want higher benefits for police officers, or various other types of public employee compensation. We can also easily come to it and say, I want better streets. I want more cops on the highways. I want better schools, depending on the level of government that we're going to. But or we can come to it and say, I want to pay less taxes. But the reality is, whatever our agenda is, whether it be to impact the dollars that we pay, the services that we get, or how we compensate the people who are providing those services. Any change is going to impact those other two categories. So when you have citizens coming forward, you understand the range of that impact, that every request has that multiple balance effect. Citizens don't necessarily understand that, and so when they come to you with their requests, they may come from just one perspective or another. So understanding the budget process helps them see the broader picture of the impact on all the different aspects involved in budgeting. In order to start with citizens, we produced a document called the South Dakota Budget Primer. This is a guide to understanding South Dakota state budget, how it's created, and the priorities and the choices that it reflects. This is available online at sdbpp.org if you're interested in accessing a copy. Now, the state government is required to balance its budget every year. It doesn't have the same opportunity that the federal government has, where it can carry a deficit. It can't delay and have a continuing resolution and not balance it. Each year, revenues have to equal expenditures. And that decision-making process for the state, just like you guys, at the local level for city government and for the county commissioners and for the school boards, all levels of government that cannot run a deficit, is you either have to increase your revenue, you have to decrease your expenditures, or you have to do a combination of both. Now, increasing revenue means changing your tax structure. That means making decisions about who's going to pay more or less taxes and how you're going to collect those dollars. Decreasing expenditures means you're either going to decrease the amount you spend on your staff, your government employees, or you're going to decrease the services that you provide, or you're going to decrease the quality of services you provide. That's why these are important decisions, and it's your community members who are best positioned to understand the impact of these decisions in their neighborhoods. They truly are the experts on their neighborhoods. They know what happens when there's a change in government services. What they don't know is how to get involved and share that expertise that they have. At the state level, getting involved in the state legislative process can seem really daunting. The budget process starts actually the summer before the legislative session, when the agencies of government all submit budgets to the governor's office, and there's hearings on those. In South Dakota, those hearings aren't public, and so we have, some states have public hearings, some don't. So the first opportunity that people in the public have to access those budget requests is when the governor releases his budget report, which is in early December. So we see early December as really the starting point of the budget process for the public. That's when they can begin to think about what is being proposed and how it might impact them. Now, that governor's budget actually gets made into the General Appropriations Bill. The General Appropriations Bill describes all the expenditures, the ordinary expenditures of government. And that bill is worked on throughout the entire legislative session. Citizens can come and testify about components of that bill. The Appropriations Committee schedules on a day-to-day basis which aspect of government financing they're going to be talking about. So it's very clear. I'll show you the point on the website where any citizen can access that. Then citizens can come and just show up at Pier. They don't even have to call ahead. Sign in at the committee room, and they can come forward and testify. What's really helpful for them in their testimony is if they understand the context of information that their decision makers also have before them. And so we're going to talk a little bit about some of the fiscal analysis that's currently available that decision makers are using at the state level in the appropriations process. There's also revenue bills, which would change tax structure, and special appropriations bills, which might do one-time spending. Together, these three types of bills, the general appropriations bill, the revenue bills, and the special appropriations bill, make up the state budget. The state budget, even though they're taking testimony on it all throughout the legislative session, and citizens can come forward and testify at these times, it's sometimes confusing when citizens testify because there's not a decision made at that point. Testimony is taken, say they're listening to an education funding area. They'll take the testimony and they won't propose an amendment, they won't propose a change secondary to the testimony until the very end of the legislative process. Citizens don't always understand this, and it's really confusing and discouraging as a citizen when you come and provide feedback to a government body on a particular issue and the decision's not made regarding your feedback at that time. So this is a challenge in communicating with citizens and in citizens getting their feedback, that when the amendments do come forward, particularly we're talking now at the state level, but applicable also at local levels, when decisions do come forward, then there's an amendment will get proposed, and the citizens who had testified in favor of it may no longer be in attendance. In the state government system, what happens at the legislature is it's usually the last day or two of session that the amendments to the general appropriations bill are made public. And that doesn't really give citizens enough time to find out what those changes actually are that are proposed, analyze the impact on their community, get that feedback to their legislators, and propose alternatives. So timing is a really critical aspect of citizen involvement. That first of all, they understand the process, understand when decisions will be made, understand when their opportunity is to provide input, and then also have a second opportunity to respond to amendment proposals. At the state level, some of the real challenges in our system are that we are a part-time citizen legislature. That means we have term limits that turn us over every couple years, so new people are coming into the system. These are part-time legislators. The good thing about a part-time legislator is they're living in their communities. They are in touch with their neighbors. The bad thing about a part-time legislator is they got another job. They're doing something else with their life, and they may not start their work as a legislator fully familiar with fiscal policy or with other aspects of government that they have to make decisions around. We also have a really short legislative session. You guys meet year-round. That's not so at the legislative level. They're working for 35 or 40 days, and within that time period, they have to reconcile a state budget to state revenue that they don't confirm the revenue amount until halfway through the session. So this means the balancing process of deciding what we will prioritize has to happen very quickly and frequently without a lot of opportunity for the public to digest the proposals, to learn about the options, and provide that feedback to their legislators. So that's a challenge. And that those final budget amendments are often not introduced until the last days of session can also present a challenge, not only for citizens, but also for locally elected officials. Because if an amendment comes out that is going to have a consequence at other levels of government, and it's going to have an impact on joint constituents that you hold in common with state residents and local residents, it's your responsibility as well to get a feedback cycle to your your state elected legislators. And so you probably are familiar with working in that time frame. We do have some really good information available to help us with our legislative decision-making process and for our citizens to help understand. And then there's some things that we lack. And I'd kind of like to point these out to you and see if you see any corollaries at the local level to what we see at the state level. At the state level, the budget that's proposed by the administration is well documented. It's available online at sd.gov. The budget itself is available online, as are the PowerPoint slides that describe all the fiscal analysis. There's also available fiscal notes on any piece of legislation. You know, you get a proposal and you look at it and you go, oh, that looks like a good idea. And then you find out how much it costs and you go, well, maybe not that good of an idea. Well, any legislator can ask for a fiscal note on any piece of legislation that has a cost, and that can help the legislature and the public understand if that's such a good idea or not. Unfortunately, in South Dakota, we don't really take advantage of that capacity to the full degree. Last year, at the legislative session, according to the Legislative Research Council, we only had one piece of legislation that had a fiscal note attached. And I can guarantee we had significant numbers of bills that went through that had fiscal impacts. The revenue estimates are another really important piece of fiscal analysis. just like with your household budget, you have to know how much is coming in before you can decide how much you can spend. We have to estimate our revenue, much as households do, and we do that based on the most recent data. And one of the challenges in South Dakota is that we wait until we get into February before we actually make a revenue projection for the upcoming year, our final revenue projection. We do that so we get one more month of data. But that keeps us from having a really clear picture, a final picture of what our projected dollar amount is. So that's another aspect that pushes this decision-making into the last couple days of session. And you know from your own experience, the decision-making that has to be done very quickly can get done, but it doesn't necessarily leave an opportunity for the broadest public input. The other piece of information that's well available is the Legislative Research Council materials that's provided to the legislators. I'm going to show you how to access these because most of that information is publicly available. We're fortunate in South Dakota to have such ready web access, online access to that information. Citizens can go to the LRC website, which is legis.state.sd.us. And here they can access information not only about who their legislators are, what bills are being proposed, what the schedule is, but they can also see the fiscal analysis that supports many of these bills that legislators have access to. And I would call your attention to, on the left-hand side of the screen here, the Office of Fiscal Analysis. If you go to the Legislative Research Council site and click that, it's going to take you to the location where most of the fiscal analysis is kept. The Office of Fiscal Analysis, this is a newly revised website as of last year. When you go to this site, you go to the current legislative session and select the agency hearing materials. That will take viewers to the Appropriations Notebook. Now this is set up in a OneNote notebook style. You don't have to have any special software for this. As a consumer, you can just get it on the internet. Along the top are tabs, and these are for each of the government agencies that are submitting budget requests. And so you can tab any of these agencies that you want. There's things like corrections, economic development, education, etc. On this particular example, I've selected education. Then you go to the side and you'll see all these separate tabs. This is all the fiscal analysis that's been submitted to the Appropriations Committee to support the governor's request for, the budget request for the Education Department. And so if you are concerned about, for example, the Education Department, you can go and look at this information to clarify what information is currently available and help frame your testimony to the Appropriations Committee. There's also really good information available at this same location on the website on things like revenue estimates. That's how they determine what they anticipate upcoming revenue to be in the next year. There's information on amendments to the general bill. Remember, I mentioned that it's a challenge because those amendments don't come out till the end of session. That's because legislators have to reconcile those amendments with the revenue report and any the revenue estimate and any other bills that might change tax structure or expenditures. This is only the second year that we've seen these amendments show up online. We think that's an excellent step for the legislature to take, to post these amendments online. That way people who don't have a lobbyist at the Capitol can also access these as quickly as people who can afford to have a full-time lobbyist. Okay, I've talked a little bit to you about the kinds of information, the good fiscal analysis that is available in South Dakota. Now I want to explain a few tools that South Dakota doesn't use that might help our citizens and our legislators in some of their long-term decision making. These are tools that are used by other states. The first is a current services budget. A current services budget basically tracks the cost of what government is likely to need to expend in upcoming years if we don't make any changes in current policy. I like to think of it as our keep on keeping on budget. So if we adjust each government service we offer by anticipated inflation, by demographic changes in our communities, and by growth, and by shifts that we know are already coming secondary to past policy changes, that is then what it will cost us in future years, our best estimate, to keep on keeping on with the style of government we have right now. Okay? That's valuable because when you see a budget proposal, you don't know if that budget proposal is an increase or a decrease to your maintenance level of government because of inflation and because of population changes. Right now, when we see budget proposals, they aren't compared to a current services budget. The other way we can use a current services budget, and that other states use it, is just doing long-term planning. This is particularly helpful for citizens to communicate to them where are we going and do we need to change or why do we need to change. When we look at that, what is it going to cost to keep on keeping on, doing what we're doing today, and what can we expect to raise in revenues in upcoming years based on our current tax structures? That's where we really answer the question, can we afford our current form of government? Does our current tax structure increase at the same rate as the cost of our current services is increasing? Now, maybe in a utopian world we'd actually see the cost of current services dropping, but we haven't seen that for a long, long time. But basically, if your revenue stream is growing at the same rate as your cost of services, you won't have a structural deficit. If your revenue stream is growing faster, you'll actually have a surplus, so you could consider either expanding services or cutting taxes. But if your revenue stream is growing slower, then you've got a structural deficit growing, and you should explain that to your constituencies so that they understand the hard choices that you're going to face. You're either going to have to raise taxes or cut services or a combination of both. I've been going around the state in South Dakota talking about this with citizens in communities, large communities, small communities. And what I'm finding is that citizens aren't opposed to cutting services or raising taxes. They want to understand why. What is the situation? What are our options? We know we have to prioritize, but we want to have frank discussions about that prioritization process. We want to know what are our options in tax structures, what does our current tax structure look like, and what are our options? What does our current expenditure structure look like, and what are our options, so that we can figure out what it is we want to do moving forward to make sure that we're in that sweet spot on our current services growth and our revenue growth. Or that if we want to expand services or contract taxes, that we have a long-term plan in place to get us there, and that we all know what it is. By the way, on that current services report, 21 states produce that on a regular basis as part of the information that they provide to their legislatures and their public. All of our neighboring states do. Minnesota is the only one that actually produces it for extended years, but the others produce it on at least a one-year basis. Another piece of information that's helpful for citizens and for decision makers is tax incidence analysis. That helps us understand how does our current tax structure impact citizens. This particular tax incidence analysis looks at it based on family income for non-elderly taxpayers, and how in South Dakota, state and local taxes impact people by their household income size. There's another piece of analysis that we don't do on a regular basis, and that's a tax expenditure report. 43 states do this on a regular basis. Why is that important? Well, tax expenditures are those taxes we don't collect. We have laws on the books that say, okay, we are going to collect sales tax on everything, except. And then we have statutes that tell us, the laws that tell us, what are the excepts here? What are we not going to collect taxes on? And the excepts in South Dakota amount to about $500 million a year in state sales tax that's not collected. $500 million a year is a lot of money in South Dakota's general fund budget. Now, those sales tax exemptions are not either good nor bad inherently, but they're part of the prioritization process in most states, in 43 states. When they're dealing with that scale and saying, are we going to cut expenditures? Are we going to raise taxes? They have a third leg of that scale, and that is, are we going to change our tax expenditures, the taxes that we don't collect? In South Dakota, in most states, they look at those sales tax expenditures on a regular basis so that those can be prioritized against the potential consequences of other choices. We did just do a tax study this summer looking at those tax expenditures for the first time in quite a while. I would think that we would be well served to look at that on a routine basis so that as those decisions have to be made, we have current data available to look at regarding them. Why is this fiscal analysis important? It's important because citizens, if they don't understand the system, if they can't see big picture questions that are well supported by data, then they'll disengage. They know they don't have time to go through a stack 3 feet deep of budget documents. But if they can see fiscal analysis that paints long-term trends for them and that shows them how dollars are being prioritized, who they're being collected from and where they're being directed, then they do want to get engaged in the process, and they are willing to step forward and become part of the fiscal policy formation process. They need a few basic facts. One of the basic facts they need is information about revenue. Where does the money come from? Sometimes they're surprised to learn that in South Dakota we are a low tax state. Everyone knows that. That's not something that surprises them. But we're a low tax state, but we're not a low income state. So that means South Dakota is something like 23rd in the nation, 22nd or 23rd in our per capita income. But in the amount of that income that we pay in state and local taxes, we're dead last. So we choose to pay about a third less in state and local taxes through our statute structure than the average citizen pays throughout the United States. If we have a buck in our pocket, if we have $1 in our pocket, we pull out about 8 cents and put that towards state and local government. On a national average of the amount of money citizens have in their pockets, they pull out 11 cents. But for that 2/3 amount of money in South Dakota, we want government services. We want safe roads. We want good schools. We want court systems that are efficient and effective and work well. And so our challenge is, how do we take our limited resources? How do we prioritize those limited resources for the expenditures we think are most important? And how do we decide what's adequate revenue and whether it's being fairly collected and fairly distributed? When we look at revenue, it's important to realize that even though we are a low tax state, taxes are not low for everyone. South Dakota has a tax system that differs from other states in that we don't collect property or income tax or corporate income tax, personal or corporate income tax. Most states do. And that tends to lower the taxes on high-income families in South Dakota relative to other states. We also have another thing that's unique in South Dakota. We collect taxes on food and clothing and other basic necessities. That tends to increase the tax burden on low-income households. Because of this, our poorest households, the poorest 20%, pay about 11% of that dollar that's in their pocket in state and local taxes. The bulk of our citizenry, the middle 60%, pay around 7%, and our top 1% pay around 2% in state and local taxes. That makes us the third most regressive state in the nation as far as state and local taxes. A regressive tax system is one that taxes at a higher rate for people in lower incomes. A progressive tax system is one that taxes at higher rates for people in higher tax brackets. So let's look at what we do tax. The main things that we tax in the state are consumption. That's sales tax, use tax, and excise tax. You can see that's the biggest bar on our graph. The next most common thing we tax is property taxes. All our other categories of taxes are pretty minimal compared to these two. Even video lottery, which we all thought was going to be the answer to school education funding, K-12 funding, is fairly small, and that amount has actually dropped in recent years. Secondary, it had kind of topped out around $120 million a year, and it's gone down a bit now, secondary to smoking ban and some competition and the recession. So consumption taxes are really what we're dependent on. Our dependency on consumption taxes is growing as a state. If you look over the last 15 years, it's gone from around 64% to around 74% of the revenues collected by the Department of Revenue and Regulation. So, taxes. There's an old saying, don't tax you, don't tax me, tax that guy behind the tree. Most of us feel that way about taxes. We don't really want to pay them. Yet we understand that the fundamental purpose of taxation is to raise money needed to fund public services. So it's a public prioritization process. What do we value in public services? What are we willing to pay for? And who do we think ought to pay for them? And it's the values of the citizenry that should inform that decision making. The other piece that the public needs to understand is how is their money being spent, because they want to know it's spent wisely. Well, one of the things I can tell you in South Dakota, when you only have 8 cents on a dollar going towards state and local services, there's not a lot of waste or fat in the system. In order to be at the 50th rank in the nation of our per capita income that we put into state and local services, we have to be efficient. Our money doesn't all come from local taxes, local and state taxes. Actually, a significant portion of it comes from the federal government. Another portion of it comes from other funds. These are fees or specially dedicated taxes that are going for a specific service. An example might be the park fees that you pay when you stay in a campground, or the gas taxes you pay, state gas taxes, when you purchase gas that go into the State Highway Trust Fund. But the part that we usually are thinking about when we talk about taxes is the general fund. In recent years, the federal portion has been really high, almost half of our state budget. That's not typical. That's secondary to the stimulus dollars that have been coming in. If you go back before stimulus dollars, about a third was federal government funds, about a third was general funds. In recent years, that's decreased for the general fund portion, but we expect that will go back up again as stimulus dollars decrease. So let's talk about those general fund expenditures, because that's what we're all concerned about when we talk about state government. Those are primarily health and human services. That's Medicaid. State aid to local schools and local governments. That's primarily K-12 education. And then the Board of Regents. As you can see, those take up the bulk of all our general fund dollars. We pointed out before that we spend less per capita than other regional states. Sometimes when you actually look at those numbers and understand how we compare, you see how efficient our government has to be. This information is located in your budget primer as well. So let's look closely at those two areas of the general fund where we actually spend our money, the bulk of our money, K-12 education and Medicaid. On page 19 of the budget primer, you'll see an example of the school funding formula. Basically, there's a full explanation in there, but basically what works in school funding is each student gets a per student allocation. It doesn't matter if they live in a town that's very property poor or a town that's very property rich. The local property taxes are equalized with state dollars, so each student receives approximately the same amount of money in their school district to pay for their education. When this formula was put in place, the intent was, of the original formula was that it would increase at the rate of inflation, or 3%, whichever was less. Over the years, the legislature they are allowed to put in more than that if they choose to, and over the years there's been times that they have. However, in the last 2 years, they've chosen to put in less. 2 years ago, they chose to freeze the formula in fiscal year 11, and in fiscal year 12, the formula was cut. This was in an effort, along with cuts to other aspects of state government, to balance the budget in the face of a structural budget deficit. But what does this mean for local communities? What it means is the actual per student allocation versus the inflation adjusted per student allocation since the beginning of the formula has not kept pace. That means that a student starting kindergarten today will have less resources, less purchasing power in resources available for their K-12 career than the child who started kindergarten in 1998. K-12 has also dropped as a percentage of the general fund expenditures, and it's also dropped as a percentage of personal income. So the amount of money we have in our pocket, go back to that buck we've got in our pocket, the amount of that actually finds its way into K-12 education through state federal fund spending is dropping as well. So this is a reflection of our choices on how we'll spend our money, how much money we have, how much we're willing to tax, and how we're going to choose to distribute it and spend it. Let's look at the other main area of general fund spending. And again, I choose these two areas because they're the bulk of our general fund spending. That's Medicaid, health care for low-income children, elderly, and disabled adults in South Dakota. Now in South Dakota, that's been growing because of primarily because of the recession, has made more people income eligible. When you look at who's on Medicaid in South Dakota, you'll see the vast majority of people on Medicaid are children. There are also adults, elderly, and the disabled. 1 out of every 2 babies born in South Dakota is on Medicaid. 1 out of every 3 children between 0 and 18 is on Medicaid. But look at what the cost is per enrollee. Children are relatively inexpensive to cover. Elderly and adults or disabled adults are disabled South Dakotans are significantly higher. 57% of all nursing home residents are covered by Medicaid in South Dakota. Almost 100% of all individuals with developmental disabilities that are receiving community-based services are covered by Medicaid. These average costs significantly impact our cost, and these are all vulnerable populations and are using Medicaid as their primary source of health care. Now, South Dakota doesn't pay for this alone. The feds, it's a joint program between the feds and the state, and the feds pay a percentage. They call that the FMAP. The reason I bring this up is because we often, in recent years, have been hearing that the federal share of our Medicaid is dropping, and that's putting pressure on our state budget. The reason the federal share is dropping, this is a graph of the percentage that the feds have been paying over recent years. There's 2 reasons this graph is changing. One, there's a couple little lumps in it. Those are when the feds were doing fiscal stimulus for all the states, and they used Medicaid as the methodology of doing that fiscal stimulus. That fiscal stimulus is done. The other reason it's dropping is because South Dakota's income is growing faster than the rest of the nation. Our per capita income is getting higher relative to the rest of the nation, and so our rank is moving up. And what the policy for the federal-state split is that the feds will pay someplace between 50 and about 83% of your Medicaid costs. And they decide how much of that they're going to pay based on what your per capita income is. Their basic thinking is, okay, if states have higher per capita income, they can carry more of their own costs. They've got money, they can tax their citizenry and pay for it. If they have low per capita income, we're going to pay a higher percentage because they don't have money in the state, so there's no way they can get the money to pay for the Medicaid needs of their state. So because South Dakota has been growing in its per capita income, we've been shrinking in our federal share of our Medicaid dollars. This is important because we really don't have very many choices as a state on what we're going to do with Medicaid. Our Medicaid costs are driven by some pretty fixed factors. One is the number of people enrolled, and that's based on categorical eligibility. The utilization of services is another attribute that determines how much we pay. But utilization of services is based on people's health. And so we can't necessarily, we have to provide the services that's demanded by the health care needs of the covered individuals. So the only real area that we have that we can adjust is reimbursement for providers. And that's significant because Medicaid providers don't receive the full amount that they would normally charge for their services. The state chooses an amount, and if you choose to participate in Medicaid, which most people in South Dakota, most providers do, then you get the Medicaid reimbursement. And that's how we have been controlling our Medicaid costs in South Dakota, is by controlling those provider reimbursements. Why should that matter to citizens? Because when provider reimbursements lag medical inflation, as they have in South Dakota, you can see our medical provider reimbursements are in green, general inflation in red, Medicaid inflation in blue. When they lag, that means providers have to cost shift. They have to recoup those dollars somewhere, so they cost shift those costs to their private pay patients or their patients who have coverage through third-party payers. You'll know that your cost of covering your city employees goes up higher when Medicaid doesn't go up because providers have to cost shift to cover that lack of keeping up with inflation in the Medicaid. These are complicated problems. People understand that these are complicated problems. And as we've been talking to citizens across the state, we find that they are willing to inform themselves in their communities. They want to be able to influence their legislators and their locally elected officials. They want to be able to make a difference. But they need good information. They need it presented in a simple and understandable way that citizens who have busy lives can understand. And so we're working to try to produce that type of fiscal analysis, encourage that type of fiscal analysis being produced at all levels of government and shared with the public in a way that they can truly be engaged in their civic duty as citizens of South Dakota. Thank you.
Thank you, Joy. Are there questions or comments for Joy? Greg.
Just wanted to thank Joy for the presentation. I think our budget analyst, Dave Bixler, can pick up a lot of tips from what you've just covered. I think there's a lot of great ideas there. I guess I just wanted to thank her mostly.
Anything, Sue?
No, my thanks to Joy. It's the second time that I've seen the presentation, and I gleaned more again this time. So it's great.
Very compelling.
Yeah.
Joy, thank you for your time. We appreciate you, and we hope to take away some lessons that we can implement into the city government budgeting process as well. So thank you. We are adjourned.